Okay, we continue with tongue diagnosis made easy, stiff tongue, flaccid, limp tongues. Uncontrolled movement and stiffness. There should be flexibility and movement in the tongues. If the tongue movements are involuntary, so hindi mo kinusang ginalaw, sariling movement ng tongue, this may be interior wind causing chi to move chaotically, or the spleen failing to control the muscles. When the spleen does not control the muscles in the tongue can quiver. So ito po yung na-observe natin na pag pinalabas natin yung tongue ng patient, involuntarily po na gumagalaw yung tongue. Sometimes the tongue will begin to quiver after the person has had their tongue extended for a few seconds. It is as if the spleen is no longer capable of keeping the tongue still. So when sinabihan natin yung patient na ilabas yung tongue, after a few seconds na linabas nila, lumalabas po yung pag-quiver ng tongue. So ibig sabihin, hindi kaya ng spleen i-maintain na steady yung tongue. Okay? In the same way that a light wind will cause a flag to wave from side to side, high winds will make the cloth of the flag hard and stiff. So the same applies to the tongue. Para din siyang yung flag, pag pwedeng mag-sway to side, or pwede siyang maging stiff dahil sa presence of internal wind. Interior wind can make the tongue sway from side to side or result in a tongue that is rigid and inflexible. So yun po yung nangyari sa tongue. If the tongue deviates to one side, this can be due to the channels on one side of the body being excess, like the presence of wind or phlegm, or the channels on the other side of the body being deficient. So dalawa lang ang pwedeng mangyari pag nag-deviate yung tongue. It could be either excess yung one side or yung other side ng tongue is deficient. A flaccid tongue, especially if it is swollen, indicates chi deficiency or phlegm. So meron tayong ditong picture ng stiff tongue, lacks normal suppleness and flexibility. So once pinalabas natin yung patient ng kanilang tongue and lumabas na parang ganito, V-shape. So this is stiff tongue. It looks hard and stiff. It indicates internal wind. So pwedeng may internal wind, blood stasis, or severe yin deficiency. Okay? Okay, next is tongue bearing or movement. The tongue bearing is also called tongue movement or the tongue state. The normal tongue can be extended outward easily and either trembles nor quivers uncontrollably. It is neither involuntary stiff nor immobile. It is flexible and moves smoothly. Sa clinical significance, abnormal tongue bearing usually indicates severe condition in the interior. Sa pathological changes in the tongue body bearing, changes to the bearing of the tongue body include changes to its flexibility, movement, and length. So sa tongue bearing, we have three division, yung flexibility, yung movement, and the length. Sa flexibility, meron tayong it's either stiff or limp. And sa movement, meron trembling, deviated, and protruding. Sa length, it could be contracted, protracted. Okay? Sa flexibility of the tongue, it refers to how the tongue moves. The normal tongue should move freely and smoothly. Sa mechanism of abnormal changes in flexibility of the tongue, flexibility in the movement of the tongue depends on the condition of its muscles and sinews. A sinew can spasm due to loss of nourishment which arises either from deficiency of the internal organs or from phlegm or blood stasis that obstructs the flow of qi and blood. In either case, there is a lack of nutrition reaching the muscles and sinews of the tongue. Okay? Pwedeng may lack of nutrition. The tongue will stiffen and its movement will lack flexibility. If the sinews lack nourishment of qi, blood, or body fluid, the tongue may also become limp. So we have here yung blood, body fluids, nag-nourish ng tendon. So there is normal tongue flexibility. Ganon din pag normal ang liver function. Pero pag merong heat or phlegm which damages the body fluid, magkakaroon ng tendon spasm. The same with liver dysfunction. So this would result to stiff tongue. Pag meron din heat sa qi, blood, gene deficiency, ang tongue mag-limp tendons due to insufficient nutrition. So we could also observe sa tongue na meron siyang limp. Okay? Sa stiff tongue is inflexible, make it difficult to move or turn. It causes slurred speech and makes it difficult to take in food. Okay, sa stiff tongue, sa indication, pag external heat invades the pericardium, the tongue body is crimson, the tongue coating is yellow. So sa pathogenesis, there is excess heat, exhaust, body fluid leading to tongue malnutrition. Pag meron siyang internal wind, ang tongue body is slightly red or green-purple, tongue coating is buried. Sa pathogenesis, there is a liver dysfunction, gives rise to wind leading to spasm of the tongue. Sa turbid phlegm naman, ang tongue body is flabby. Pag tongue coating, thick and greasy. Pathogenesis, there is phlegm obstructing qi and blood leading to tongue malnutrition. Okay? Sa flaccidity, if the tongue seems limp and lifeless, this may be due to lack of fluids or blood, causing the tongue to wilt. There may therefore be a qi deficiency or blood deficiency. Alternatively, heat may have damaged the fluids. The color of the tongue will determine whether it is blood deficiency or qi deficiency condition. On the other hand, or yin deficiency or heat on the other. In the first two cases, the tongue will be pale, and in the latter two cases, the tongue will be red. Okay? This refers to a tongue that is so weak that its muscles atrophy and it is unable to protrude or curl up. In severe cases, it has a crumpled look with many wrinkles on its surface. Okay? So, sa limp tongue, ang indication, if there is a severe qi and blood deficiency, ang tongue body is pale, tongue coating is buried. Sa exhaustion of yin and body fluids, ang tongue body is crimson, tongue coating is dry with no coating. Sa pathogenesis, there is extreme deficiency lead to malnutrition of the tongue muscle. Pag there is presence of excess heat, tongue body is red, tongue coating is yellow, and sa pathogenesis, heat injures body fluid leading to tongue malnutrition. Okay, sa abnormal movement of the tongue body, under normal circumstances, the tongue should be stable, without trembling, hindi nag-quivering, walang involuntary or uncontrolled movements. It should have symmetry without deviation. Sa pathomechanism of abnormal movements of the tongue, spasm of the sinews and muscles cause abnormal movement of the tongue. The liver controls the sinews and the spleen controls the muscles. Spasm can be caused by either internal wind, which is often due to hyperactivity of the liver, internal excess heat, or by malnutrition due to insufficient qi, blood, or body fluid. So pag chi, blood, and body fluids nag-nourish sa tongue, so there is normal tongue movement. Pero pag meron it is deviated, chi and blood flow unilaterally, block and collaterals with the presence of wind or phlegm, so magkakaroon ng deviation. Pag merong internal wind, lack of nutrition, so makita natin yung tendon spasm, the tongue would be trembling. Pag merong heat in the heart or spleen channels, meron siyang oral discomfort, so makikita natin protruding and leaking. Okay? Sa trembling tongue, quivering tongue, when the tongue is extended or retracted, the tongue body shivers or quivers uncontrollably. Trembling tongue, pag may deficiency of qi and blood or yang depletion causes body fluid impairment, the tongue body is pale or pale and limp. Sa pathogenesis, qi and blood or yang deficiency fails to nourish the tongue. Sa internal wind due to extreme pathogenic heat, the tongue body is red and dry. Pag merong alcohol intoxication, ang tongue body is deep red and swollen. Sa pathogenesis, internal pathogenic heat gives rise to internal wind and endures body fluid which fails to nourish and moisten the tongue tendon and muscles. Okay? Next, sa moving. The moving tongue moves slowly from side to side with large amplitude movements when it is extended, and the patient cannot control its movement. It always indicates internal wind and usually seen in the elderly. So usually po itong moving tongue nakikita sa mga matatanda and meron siyang large amplitude movement. So ibig sabihin malaki po yung galaw ng tongue from side to side. Pag quivering naman, the quivering tongue trembles rapidly with small amplitude movement. So maliliit lang po yung galaw habang ito ay ini-extend. The most common clinical significance of a quivering tongue in chronic condition is spleen qi or spleen yang deficiency. Okay? So, sa moving tongue, internal wind, sa quivering, spleen qi, and spleen yang deficiency. Tongue signs associated with internally generated wind. Symptoms that occur suddenly and are characterized by trembling and tremors, spasm, vertigo, muscle tics, sudden numbness, or convulsions reflect the internal movement of wind. An illness caused by internally generated wind can leave serious damage in its wake. However, there are a few warning signs that signal its approach, one of which being a constantly moving tongue. So, makikita kaagad natin yung sign na merong moving tongue. When extended, it moves from one side to the other. Alternatively, the patient will be unable to extend the tongue fully and will retract it only to extend it again. So, yan po yung internally generated wind. So we have here a picture of another tongue. A noticeably stiff tongue body that is very red or is covered with a thick, greasy coating also reflects the formation of internally generated wind. So deviated po siya. This is an important tongue signs, especially in conjunction with other appropriate symptoms. Clinically, internally generated wind frequently occurs in those with long-term deficiency of kidney yin, which can lead to the ascending of liver yang. Often, a severe quarrel or fit of anger is enough to trigger the uncontrolled movement of the internal wind, which will cause a deviation in the tongue. Okay? So, merong deficiency ng kidney yin, mas naglalala po internally generated wind. Sudden loss of consciousness, spasm, or the sudden deviation of an eye and mouth are characteristic signs. As a rule, the tongue body is red and dry because of the underlying deficiency of kidney yin. So, dahil po sa kidney yin, gumalaw po yung tongue. A pale and deviated tongue body is indicative of liver blood deficiency naman. So this one, liver blood deficiency, ma-observe natin na pale ang tongue, generating internal wind din. The paleness of the tongue reflects the liver blood deficiency, while its deviation is typically of internally generated wind. Okay, pale ang tongue, so there is a liver blood deficiency, pero kung meron ding deviation, it is because of internally generated wind. The symptoms are less severe in deficient type internally generated wind than in the excess type. So, kumpara sa excess and deficient type, sa deficient type, less severe ang symptoms ng paggalaw ng tongue. And include numbness of the extremities, merong tics, and slight tremor of the head and hands. Okay? Next, we have a pale deviated tongue. So, observe natin yung tongue picture. Can also occur in the case of externally contracted wind cold that blocks the channel in the face, possibly causing facial paralysis. So, ito naman, externally contracted wind cold ang dahilan. When wind phlegm causes dizziness, numbness, headaches, or even a wind stroke, the tongue may deviate and be covered with a thick, greasy coating. Okay. Internally, wind can also arise from externally contracted heat from excess. So, pwede rin sa externally contracted heat from excess. This will cause illness that are characterized by high fever. The heat penetrates into the blood level and causes skin rashes like the petechiae that appears during the course of meningitis. The internally generated wind is responsible for convulsion or rigidity of the neck. The tongue is also deviated and frequently present with red, raised points that denote heat in the blood and the presence of toxic heat. So here we have a case of a male, 35 years old. Ang tongue po ng patient is reddish, slightly blue, stiff ang tongue body. So this indicates that there is a kidney yin deficiency and blood stagnation obstructing the channels. Meron din siyang deviation, deviated with yellow greasy coating. So ito po is wind phlegm blocking the channels. Meron siyang notch at the tip. Kung observe po natin, meron siyang parang hati sa dulo ng tongue, indicating that there is a heart blood deficiency. Sa symptoms ng patient, there is extreme stiffness and pain on both elbows and right knee. Meron siyang fatigue, meron siyang depressive moods. Sa Western diagnosis, there is a degenerative joint disease with involvement of multiple joints. Meron siyang early stage in atrophy of various muscle groups. Sa background to disease, there physical overexertion at work and repressed emotions. So sa case po ng patient natin, Mr. F, 35 years old, worked as a craftsman for 10 years. The pain in his elbow began during this time. His complaint developed so quickly that before long, he could not bend his elbow. The stiffness was soon followed by atrophy of the muscles of the underarms, which forced him to give up his work. So, nagkaroon ng stiffness, nagkaroon ng atrophy, hindi niya magalaw yung elbow. He also experienced severe damage to the cartilage of his left knee, which was painful upon exertion. Mr. F reported that as a child, he had suffered from pain in his right knee. So, even nung maliit pa siya, meron na siyang pain sa right knee. The impression he gave was that of a very unhappy and introverted person. The tongue was stiff and deviated. His pulse was very tight. Okay. Sa analysis, Mr. F suffered from a constitutional weakness of kidney yin. Over the years, the deficiency of kidney and liver yin led to malnourishment of the tendons, sinews, muscles, and bones. Because his joints had been weak since childhood, the physical demands of his job triggered local stagnation of qi and blood in the elbows, followed by the muscles of the underarms. In this case, the blood stagnation obstructed the channels and was responsible for the extreme stiffness in the joints. This stagnation is visible in the slightly bluish tongue body. So makikita po natin yung parang bluish na tongue body, which indicates that there is presence of stagnation. It is possible that the stagnation in this area was aggravated by the presence of phlegm. So pagkakaroon mas lalala dahil sa presence ng phlegm. And makikita natin ito na may greasy tongue coating. The deviated tongue indicates the formation of internally generated wind and would be a warning sign that the illness is progressing. So pag naka-observe po tayo ng ating patient na merong deviation ng tongue, this indicates that or nag-ano sa atin ng warning sign that the illness is progressing. So we have to do something about the condition. All of this points to the possible involvement of other joints in the body. In summary, the internal movement of wind was caused by the deficiency of kidney yin and blood, which was also responsible for the atrophy of the muscles. So ang patient natin merong kidney yin deficiency and meron siyang blood deficiency. Okay? So discussion, internally generated wind only occurs when energetic disharmonies exist in the body for a long time. So itong case ng patient natin, matagal na po nagsasuffer. All of the causative factors that lead to deficiency of the kidney yin and blood can cause the formation of internally generated liver wind. So dahil po sa kidney yin and blood deficiency, nagkaroon siya ng formation ng internally generated liver wind or contribute to the movement of internal wind in the channels. Stasis of blood, phlegm, and damp heat are other factors that play a role in the formation of internally generated wind. With blood stasis, the stiff or deviated tongue body will have a bluish hue. Damp heat and phlegm are associated with a yellow greasy coating. Okay? So thank you po for your attention.
Thank you very much, Sir Dino.